Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year, mostly due to osteoporosis. A lot of them are never noticed because they're not painful. However, that is not always the case. Half of women and 25% of men will have an osteoporotic fracture in lifetime. Once a compression fracture occurs, the risk of additional fractures goes up fivefold. The symptoms may include sudden onset of back pain that worsens while standing or walking, limited spinal mobility, and it could be height loss, deformity, and or disability, especially if you've had multiple fractures in a row, up or down. Here's the downward spiral. You have spinal fractures, it leads to back pain. Then if you get more fractures, it can lead to deformity with sort of hunching forward. It can pinch on the lungs and decrease your lung capacity. It can lead to loss of appetite because it starts to pinch on the stomach. It can cause sleeping problems, less activity, which leads to more bone loss from the osteoporosis, more fractures, increased comorbidities, and then all in all, a 23% increase in mortality is what's seen. What are the treatment options? Well, the first one is benign neglect. If the pain is not bad, then it may be that you don't need to have a surgery or whatnot. Medications can be very helpful, anything from over-the-counter pain meds to narcotics or muscle relaxers. Spinal bracing, such as you see here, this is called a Jewett brace. It's 3 points of compression, chest, back, and abdomen, okay? That can help people stand upright and relieve pain. There's also a TLSO, which encompasses sort of the whole torso. That's a lot more cumbersome and uncomfortable, but it does the job. Vertebroplasty procedure was invented back in the 80s for treating cancer fractures. Eventually, it was so successful, it spilled over into treating regular osteoporotic fractures in the 1990s. And it's an outpatient, low-risk procedure that provides instant pain relief. In the late 90s, the vertebroplasty evolved into kyphoplasty, which became FDA cleared. It wasn't really super-duper popular until about 5 years later. It's very similar to a vertebroplasty in that bone cement is injected into the fracture, but there's a different technique in how it's done. Here's how it's done. The tools are inserted in the vertebral body that's fractured. You can see that it's more of a wedge as opposed to a rectangle, okay? The spinal canal itself is missed completely as the catheters go outside of that through a bone called the pedicle. A saline inflated balloon is then put in where you have dye so a doctor can see the balloon being inflated. That's then deflated, and under low pressure, cement is inserted. Okay, the procedure is then complete. The bone cement hardens in about 20 minutes, and most patients go home the same day. What are the outcomes? Well, it's usually immediate pain relief. It's like an internal cast. The aches and spasms may continue for a few weeks, but most of the pain resolves right away. Over 90% of patients see dramatic pain relief immediately with significant increased function, including walking and performing all activities of daily living. There have been some studies which have shown questionable benefit of kyphoplasty. Those have been far outnumbered by the ones who have shown incredible pain relief. Top non-operative pain management in Texas is through the Texas Pain Network. There are several pain clinics throughout the state participating, accepting over 50 insurances, and providing over 25 treatment options with the board-certified physicians. Visit us online today at painmanagementaustintx.com, and then call us in the Austin area for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.